Depression is one of the most common mental illnesses in the U.S. It affects about 15% of the population at some point, with almost twice as many women as men affected in every age group.
Recent national surveys estimate that about 16 million individuals over the age of 18 experienced clinical depression within the last year. Depression is a serious mental illness that affects individuals of all ages, genders, and cultural backgrounds. Depression can affect both young people and those later in life. Additionally, new moms can suffer from postpartum depression. This can affect 10 to 15% of mothers and occurs 41% of the time if they experienced it previously.
When depression occurs, it can greatly affect a person's ability to function at work, at school, and in relationships. In severe cases, it can lead to suicide, which has recently reached its highest level in more than 25 years. Depression was recently considered the leading cause of disability worldwide by the World Health Organization. When a person is depressed, it affects not only the individual, but the entire family. It is often written off as normal sadness, and so it is ignored, dismissed, and ultimately untreated. A clinically depressed person may begin to isolate and may then be pushed by their loved ones to just get over it or to get out more. But by its very nature, the depressed individual feels as if an increasing weight has been placed upon them, requiring a much greater effort to motivate and accomplish even the simplest tasks that they used to perform.
Sadness is a part of depression, but in some people, depression shows itself as not having any interest or pleasure in their usual activities, just having a real blah kind of feeling. Our standard in classifying mental illnesses outlines 9 symptoms. A person who is depressed would show at least 5 of these symptoms over the past 2 weeks. Depression can show differently across cultures. Also, people are often reluctant to talk about their symptoms. They may be fearful or concerned that if they're diagnosed with depression, it's a sign of weakness, or it's a personal failure, or a spiritual failure on their behalf. These fears often prevent them from talking to their healthcare provider, but having a conversation about these symptoms is the first step in determining if you have depression.
Depression is distinguished from normal sadness by its link with other symptoms occurring at the same time. The symptoms happen at a greater intensity than normal and throughout the day over long periods of time, for months, even years in some cases. A trained professional can determine the particular type of depression that is happening. For example, it commonly occurs in individuals with bipolar disorder. These individuals require a very different type of treatment. To accurately diagnose depression, information from family members may be particularly helpful. Simple, standardized rating scales may also be utilized to assist with the diagnosis. While sometimes no specific cause is identified, depression may occur in various psychiatric and medical conditions. It may occur in particular neurological conditions such as brain injury or stroke, hormonal conditions such as thyroid abnormalities, infectious diseases, or by certain substances and medications. A medical evaluation that includes specific blood tests may be necessary so that the underlying causes are recognized and ultimately treated.
Like many medical illnesses, early detection and treatment is essential. Fortunately, there are a number of effective medical and non-medical treatments available. Treatments may be used over relatively short periods or long-term, depending on the condition, severity, and other factors. When individuals respond, they often wish they had received the treatment sooner. Researchers are constantly looking for new ways to better understand, diagnose, and treat depression among all groups of people, such as tailoring treatments based on a person's unique genetic makeup, to improve efficacy and minimize side effects.
At Santa Clara Valley Medical Center, we employ a multidisciplinary and coordinated approach to care and are able to offer specialized medical and non-medical treatments for this and other disabling mental conditions.
These services are available at the medical center and its many satellite locations.